Hello, my name is Rosberly Ortiz and I am going to be providing you with a rhetorical analysis on the document Better Health Through Equity, a case studies in reframing public health work. And this was released in March 2015 by the organization called American Public Health Association. These are the rhetorical strategies I am going to be focusing on during the presentation. I will be talking about the page layout, the text, the visuals used in the report, the credibility of the content, the research strategies to back up the document, and the persuasion strategies to convey the message. The thesis for my presentation is Better Health Through Equity utilizes success stories from 5 different states addressing the causes of health inequities and the efforts to create health equity. This report shows an effective design to present their message to the audience. In these images, we can see that the document is well structured. For instance, the page layout of the report has a fair amount of white space surrounding the text and the images. It also uses white margins. These screenshots show that there is around 1-inch margins framing the document. The text lines provide around 14 words per line, and the document text is organized in a single column. The strategies make the document visually appealing, organized, pleasant to read, and it also makes it look professional. The pages of the document include a fair amount of text. Each page contains around 5 paragraphs and the text is double-spaced. The paragraphs are made of 4 to 6 sentences, neither too long or too short. The report is not hard to understand. It seems to have college literacy level. However, I think the public health field would understand it better just because of the terms used and the topic being discussed. If you look at the screen on the upper right corner, you may also see that the title is separate from the text and it has large font and it is capitalized. The headings have a different color from the text and they have a larger font. This complements the graphics provided. Also, using different colors in the text enhances the readability and it helps to convey the message. The visuals are very important in this document. The statistics, for instance, help the readers to understand the importance of health inequity and to compare and contrast the communities being affected by this issue. The orange infographic represents the percentage of kids being affected by poverty and obesity in the county of Menominee, Wisconsin. Meanwhile, the maps help the audience to locate the state that is being mentioned in the report. Also, the visuals of people in this document depicts the ethnicities that are most affected by health inequities. In this case, the African Americans and Hispanics. Now, I am going to be talking about the credibility of the content. This report was published by the American Public Health Association, or APHA. And I read a little bit about this association, or actually went into the website to know a little bit more about it. And it says that it was founded in 1872 at the time when scientific advances were helping to reveal the causes of communicable diseases. Since then, this organization advocates for public health policies and programs. Their mission is to improve the health of the public and achieve equity in health status. Some memorable issues they have worked on include AIDS, teen pregnancy, communicable diseases, and medical care. All the information they get comes from public health professionals and it is updated every year with the latest research. The report actually talks a little bit about the organization. They describe that APHA champions the health of all people, and they speak out for public health issues and policies backed by science. So this gives the document credibility because this organization has been in the public health field, or working in the public health field for many years. They also surpassed the 300,000 Twitter followers of @publichealth, so it means that it is a recognized organization. For the research, They got the support of the Centers for Disease Control and Prevention and conducted a series of 5 case studies. They worked with public health agencies that supplied the best information stories from Colorado, Oregon, Texas, Virginia, and Wisconsin, relating to social determinants of health affecting the communities and the efforts to achieve equal health. To back up the report, the organization also relied on websites owned and operated by the government. Websites ending in .org, .edu, and .gov are trustful websites, and having these resources cited can help the audience identify where the research came from and how reliable it is. The last strategy I will be talking about is persuasion. So what is this report trying to convey? What is the purpose? And what are the persuasive strategies used to convey the message? Well, this report is meant to communicate information based on research and analysis of the stories provided by the health agencies. The purpose of this report is to build knowledge and skills to shape and achieve health equity. The audience is meant to be all those involved in the public health field. The persuasive strategies used for the report include ethos, pathos, and logos. Examples of ethos include the credibility of the content. As mentioned before, this information comes from a known organization that has been working in the public health field since 1872, and they used empirical data to back up the report. The moral principles include health equity for all. They believe in helping communities, they believe in education, and they believe in respecting communities' values and beliefs. For pathos, the document contains stories based on the 5 case studies. The stories involve the social determinants that affect the quality of health in the communities and the efforts to accomplish fair healthcare. For instance, the report mentions the creation of the Equity and Empowerment Lens, which is a program in the county of Multnomah, Oregon. They talk about the experience on addressing inequities in the healthcare system, and they advocate for health equity through providing quality improvements in assessments and explaining how the role of an agency contributes to the community. Lastly, for logos, this report has statistics. It has cited facts and logic argument that helps the reader to understand the material and to accept it because they provide a good design to convey the message. This has been a rhetorical analysis on the report Better Health Through Equity by the American Public Health Association. I hope you've come away with a better understanding of the strategies used in this document to present their message. Thank you so much for your time.